So here are some more examples of the ball, how to use a ball correctly. I want to show you there are two different sizes. It's not two different sizes, but this is much more firmer than this one is. And I use a smaller ball when you're working with the QL muscle, and that's why I'm going to use this one, okay? So I want you to lift this one up, and I want you to, so in between your ilium, which is the hip bone, and your rib, there is a spot there, and you're just gonna, ideally you're gonna use two balls of the same size on both sides so that you can feel, I don't have it right now, so I'm just gonna do it like that. So if you have two balls, or even if you roll up a hand towel and make a good ball out of it on both sides, and you can just lay, doesn't it feel good? Mm-hmm. It feels really, really good to stretch that QL muscle. So you're gonna hold it right there, okay? I'm not holding it for 2 to 5 minutes in this video, but you need to do that at home to release this muscle, okay? So the another example is you could use the same ball in the scapular area, wherever you have to roll on it in order to kind of know where to put the ball. And wherever there is tightness, you just stay there and relax. Okay, so shoulder pain patient, scapular pain patient, this is a great way to release that. So another way is, many people are tight here, so I want you to go on your side and you're going to be laying on it like that. So kind of like this, with your hand up on your head, like you can relax your hand and just stay there. So that is a good way of stretching underarms. Many times that's what is tight. Okay. Hold it for 2 to 5 minutes. Another way of stretching QL, I've shown QL so many times. Go ahead, roll over on this side. So only for the roll on your side. Yeah.
Right.
No, the other side. I want the back. Okay, so I can put this up here like that. So the ball remains between the hip bone and the ribs. So you kind of like lay on it and relax in there. Osteoporotic patients or osteopenia patients, do not do this because that would be too much on your ribs. So you don't want to do that. Okay, hold that for a little bit. Now you're going to lay on your stomach. So this is, I have shown this, this is a great stretch. So I'm going to use two similar balls and I'm going to put this under your psoas. This way that you find the psoas is you go from your belly button to the ASIS, which is the hip bone, and you draw a line, and it's like halfway between that line, okay? Exactly in the middle. And I like to do it on both sides because it keeps you kind of even in the back. And then you do it and you hold it for 2 to 5 minutes. Now remember, if you are a patient that has difficulty with the arch of the spine, I would suggest put a small pillow here so it still maintains the spine straight. Like in my experience, my stenosis, low back stenosis patient will have a hard time because they don't like any kind of an arch happening. It's not good for them. So I would suggest you put a pillow under your belly when you're doing this. Another way, I really like a good stretch along with the quads. So if you do the psoas and you bend your knee, you're getting a stretch for your quadriceps as well as your psoas. Okay, hold it for 2 to 5 minutes. And then, now that you're already in this position, I'm going to show you how you can release your pecs in different positions. So you can hold it like that, and you can turn your head this way and feel that stretch on your pectoralis muscle. okay? So pec is such a big muscle that I would like to do it in all three positions. So another position would be here, okay? So now your arm is 90 degrees. Before the arm was close to the body, and you hold it for 2 to 5 minutes. And then another position is over here like that. And then that's also a great release for your pectoralis. Okay, another one is, so go on your side. So this is one of the best things for hip bursitis. I'm going to give you a pillow because I really think you should be comfortable while we're doing this, okay? So for hip bursitis patient, most of the hip bursitis patients have issues with the ITB, and you have to release the ITB. I will use a softer ball than this because ITB typically is very tight on most people, and I like to use something soft so that it doesn't cause so much pain that they are not able to handle it. So I'm going to go with this ball. So in order to release the ITB, you first have to release the TFL, which is this muscle. So this is where your hip joint is. If you feel it, this is where the hip joint is. And you are going to put the ball above the hip joint, never on the joint, never ever on the joint itself. So you're going to be on top of it, and you hold it for 2 to 5 minutes till it completely releases. So the way you know it's released is either you put a timer or you go by your pain. When you put it and you have pain there, you breathe and you let go and you wait till the pain is completely gone, and all you feel is a sensation of pressure. You don't feel any pain, and that's when the muscle has released. And I would even hold it a little bit longer than that, okay? And then what you're going to do is this is the hip, you're going to skip the hip joint. You do not want to put the ball on the joint itself. And then you're going to go below the hip right here, and then you're going to just lay there, and that's your ITB. And you're going to find all the spots on your ITB. You're going to go all the way from here and even over here to release that ITB. And once you release that ITB, your hip bursitis tries to get better. Another way you can get your bursitis better is if you are a person who walks a long time, that's really not good for your hip bursitis because it's aggravating it. So as you are trying to heal it, I would say take 10-minute walk, not more than that at one time, but you can repeat that multiple times in the day. And then keep doing your ITB stretches. And come and see us for myofascial release therapy when all this coronavirus is cleared and we can all come and see our therapist. So, and you keep going and hold it till the pain is completely gone. Now at this point, I'm not on her knee, I'm above the knee, okay? So we still want to not push the knee with the ball. The joints are not supposed to be pushed with the ball. Okay, and now you're going to still go below the knee and find all the little spots. Even though the ITB ends here, the fibers of the fascia go all the way down to the foot. So you need to start releasing it at every point to the foot, basically. I'm not holding it. You should be holding it for 2 to 5 minutes. So you're going to hold it there. Find any spots over here. If you find any trigger point, you're going to stay there. Okay? So that's for your ITB. Now, we're going to do something for the inner thigh. And for the inner thigh, I'm going to use a bigger ball. You need it. So you're going to hold it here, and then you're going to use the pressure of your leg to move into that ball. Do you feel the tightness there? So you're going to wait there till the pain goes away. You'll feel the pressure sensation, but you will not have pain. So stay there for a few more minutes. Okay, and as you get better, as the pain goes away, you're going to come down to the middle. Same thing, you find all the points of pain and tenderness and stay there for 2 to 5 minutes, and then you're going to go over here, but not at the knee joint, okay? The joint remains free. And you're going to also be here, same thing. Okay, all the way here. And one more good thing that I can tell you is to work on that shin. Do you know how to do that? Go on your feet, like over here, like, yeah. So many a times when you have pain, you could do it on this side. So many people have pain in their like shin area that goes all the way into the foot. So I want you to release this muscle by treating it, and this is a good way of treating it. So find that spot of pain and tightness and roll it. First you might have to roll it to find where that pain is, and then you stay there for 2 to 5 minutes, and that should help. Thank you.